Good morning.
Good morning. Thank you, Madam Chair and Commissioners, for allowing us to come back. Commissioner Kaylee, did I give you a handout? I can't remember if I did. Okay. I was thinking I passed you by. Okay, so we have the report as of June 1st and the cumulative cases in Clay County and in Minnesota are not, they're not rising significantly for sure. That's been great. The deaths have remained stable in Clay County. We don't have any new deaths to report. Our active cases are at 46 now, so that's a pretty significant decline. 2 weeks ago, they were 81, so we're really seeing the number of active cases, which is really good news, are declining, as well as you can see, our 14-day case rate per 10,000. That's also on a significant decline as well. So it's really, really great that people are getting their vaccinations and still trying to protect everyone by wearing their masks if they're not, and doing the public health prevention things that we've talked about throughout the whole COVID. Our Clay County active cases on the next page, you can see the adolescents are the ones that are at the highest number. The 10 to 14, we don't have vaccinations for that. Well, we just started vaccinations for the 12 to 15-year-olds, so we're just getting those going in our community, but they have not had vaccinations like the rest of the population. The cumulative case age grade is the 20 to 24, which has been one of the highest cumulative cases as well. Hospitalizations are down across the state of Minnesota for COVID cases. We've only had a couple of hospitalizations down, of course, on the other side of the river as well. So that's really great. And that's the statewide hospitalizations on the third page, which I already reported. So the data is looking very good.
Great. Jamie?
So looking at vaccine administration in Clay County and Minnesota, I just want to point out that there was a difference from the last report 2 weeks ago, because they're looking at the population age 12 and over now, where it was 16 and over on the last report. But we've made some progress in the reporting from the North Dakota side as well. So for Clay County, the individuals with one dose of vaccine is at 53%, and those who've completed the series is 48.2%. And then you'll see the 12 to 15-year-old, there are 667 in that age group that have been vaccinated with one dose yet, and 455 of the 16 and 17-year-olds. So we're seeing some progress with the students. And then also basically our highest population is the 65 plus that have received completed series as well. And then comparing that to the state data, statewide, Minnesota, there are at least people with at least one vaccine is at 16.2% of the population. And again, this is 12 and over. And then those with a completed series at 55.1% and 12 and over. So even though now we're looking at the total number of 12-year-olds and greater, where it was 16 and over, the data that we were looking at previously. And then just looking at the zip code data, just to make it a little bit more confusing, this data is still based on the 16 and over population. So it shows you the percentage of individuals by zip code in Clay County that have been vaccinated, and then the number of individuals in that age group 16 and over remaining to be vaccinated. And then looking at the doses that Clay County Public Health has administered, we are now at 14,524, and just 85 vaccines were administered last week. And then we have the data for North Dakota at the bottom, just looking at Clay County, the percentages compared to Minnesota, and then North Dakota data as well. And this data is 18 and over for Minnesota, so all the data is a little bit confusing in how it's put together, but that's what we have from North Dakota. And then the last page is the cumulative cases by zip code. And then the since the last report that we gave and the doses there. And then I will just talk a little bit about what we have planned this week so far. We had quite a few second doses, so we pushed that out last week in order to give people a week to register for the clinic. But we have a clinic scheduled for Friday from 9 to 1 p.m. And we are offering 40 Moderna vaccine. We have 50 Johnson & Johnson, and then we have 24 Pfizer, and those are both first and second doses. And we have a team meeting this week to talk about other plans for administration of vaccine. And we are officially back in the Family Service Center this week. So,
Great updates.
And then I included the vault saliva testing information. And so the week that they have, the last week was May 16th. So they're a couple weeks behind with their data, but you see the total number there of tests conducted were 276. So we're really seeing a decrease in the number of testing. The week before it was 403. So we're seeing the numbers of testing going down. They do potentially have at least another month to be here, and then they'll determine based on what's going on in our community about, if the cases are ramping up, we're seeing some changes. So they'll continue at least for another month at that site.
Kathy, are the hours still the same at the saliva test?
They said they were going to change the hours, but we have not seen that information sent to us yet about hours change. So when they notify us about that, we'll be sure to post it on the social media and our website as well.
Commissioner Kaylee has a question.
The Pfizer vaccine doses that we have, are those being saved for that teen age group, or is it open for anybody?
So for now, it's an open clinic. So we do have the people that we've invited for the second dose have already registered, so those slots are filled, but otherwise it's an open clinic.
Any other questions?
All these children that are being vaccinated, I think they need a parent. Do they need a parent signature, or
They
can
do.
a child just go in and, so up to what, the age, 18 or?
Up to the age of 18, and that is like any vaccines that we offer to children, we have to have parent consent. So we have two ways to have them consent. When they register, they read the information and they sign that they've reviewed the emergency use authorization, but we also have a written consent that we have them complete for us as well.
Okay. Of course, now it's sort of a moot point as far as going into the schools to do it, but was that ever a plan, or of course we never got there probably, yeah.
By the time that the age was announced, the schools were pretty busy in wrapping things up, but we had some conversations with them about summer school and then summer activities, and so that's kind of what we have to talk about, what's convenient for the families and works well for the schools.
Okay.
And Madam Chair, there is, I know Commissioner Gross, you had asked or talked about in the past incentives. So Minnesota is offering incentives now for those getting vaccinated. We won't be involved with that as far as submitting names, but individuals that get vaccinated can submit their names in for some of the incentives that are being offered across the state.
So the kids get a free drink then if they didn't ask.
Hopefully that's not it.
Any other questions? Well, it's really been a marathon, not a sprint, and I think that having you wait a week certainly was appropriate. I don't think that anything major has happened to warrant you to come back on a weekly basis at this point still, Steve. So continue with every other week until we decide further.
Okay.
Thank you.
Thank you.
Thank you.